is catching a flight from Port Elizabeth to Cape Town. So I don't know whether Lindokuhle is standing in to give us apologies. But welcome to our honorable members, our staff, and I would imagine the Auditor General's team is also going to be introduced quite soon. But let me give you this opportunity to the staff leader, who probably Ms. Lindokuhle, to introduce, to indicate members who have logged in, and those apologies over and above the two that I have mentioned.
Thank you, Chairperson. I would like to ask Mbali to do the register. Thank you.
Okay, Mbali, can you assist us?
Morning, Chair. In the meeting, we have Dr. Jomo, Ms. Gela, Mr. Sokacha, Dr. Jacobs, Ms. Gwahube, Ms. Wilson, Ms. Ishmael, Dr. Tembegwayo, Ms. Chirwa, Ms. Shlengwa, Mr. Van Staden.
Okay. Thank you very much. Welcome all members. That is taken as our register being ticked and will be then confirmed in the minutes also. We welcome the Auditor General, who was supposed to be with us early in the week, but we have them today. And I had a brief call with the AG that there are certain things that they would like to take us through, but their report is not comprehensive, and they will indicate some of the issues that they have not included, but things that they've already put in there are actually good enough to support us as we will be meeting the department tomorrow and doing oversight. And we then want to welcome the Auditor General's office, and I don't know who is the leader there. They will introduce themselves and then start the presentation to us. Eugene, I don't know whether it's you or it's going to be Tapelo, but one of you will then take over now and introduce yourself. We are going to be listening to your oversight report that you have done over the department. Thanks, Eugene.
Thank you very much, Chair. Good morning, honorable members and colleagues. I really do appreciate the opportunity for us to provide some feedback to the Portfolio Committee. I also want to say it's also good to see everybody that's still in this meeting, as based on our current situation, we always want to take these instances for granted. So it's really always good to be back to the Portfolio Committee, and also to be able to provide some feedback in terms of how we can also strengthen your oversight that you execute over the actual department. So the purpose for today's session, we know we received an invite regarding the specific APP review for the department and its entities. But I think what we then also did was we thought, let us also use this opportunity to also brief the Portfolio Committee on the special report outcomes that we've had last year. So you would recall we had an engagement last year with we had a request from the president last year, where he asked the late Auditor General, Mr. Kimi Makwetu, for us to actually go and also do some of these special audits, where we go and audit the COVID funding as and how it gets distributed. So obviously health being one of the key cornerstones of the rolling out the specific funding regarding the COVID and the prevention strategy. There was also quite a large amount of money that was earmarked for health. So we then thought, let us, because we haven't been able to present our findings and our observations that we've actually had during our course last year with the Portfolio Committee. So we thought, let us also use this opportunity today to do that. So I think maybe that's just the way we are linking it up. So maybe just to also give a bit more information. So then regarding the APP.
So Eugene,
yes, sir.
In your background, Eugene, it sounds like someone is cleaning the floor, or if we can all mute and only leave Eugene to have his and only have Eugene his line on, and make sure that around him also there is no too much noise. Thanks, Eugene.
Thank you very much, sir. And maybe it's just a connection, I'm not sure. Just a bit of a distribution. Yeah, thank you very much. So we did do a very high-level review of the APP for the department. We looked at 21, 22, the interim review. We did also provide the department with specific findings or observations for them to consider. But I think in the midst of all the work that's going on with health specifically, you will also know that currently we're also then focusing a lot more on the actual COVID funding and COVID relief funding that the department received, and then also the distribution thereof. And then also in terms of the vaccine audit, we're also looking in terms of the procurement, etc., all of those things. So I think what we then did is we did a high-level review, but we haven't had time to actually go back and see whether or not the department have actually implemented some of those observations. So what we then said is for this specific meeting, let us share, we shared a document with the portfolio committee members for them to take, for you to take note of. And then also, but I think the key essence for today's session, what we want to actually share with the portfolio committee members is our special report outcomes 1 and 2. So we've prepared a presentation for the portfolio committee members where we're going to share the outcomes of our special report 1 and 2. And then we've also shared the document already for the APP for you to take note of. And if there are any questions towards the latter part of the presentation, we can take questions on it. But I think for the purpose for today's session, I'm not gonna go into that presentation on the APP. And I would rather use the time to brief the portfolio committee on our special report audit outcomes, which will definitely also strengthen the portfolio committee's oversight regarding when you actually meet with the department tomorrow. So that's the approach we thought that we're going to take on this interaction. And then what I also then did is from my side, we also then invited the team, because we are quite a big team that actually compiled the special report. And then we also invited the specific team to also be part of this session from the Auditor-General side, and then also do the specific presentations for their specific sections. So if Honorable Chair, if you'll allow me, I'll quickly introduce the team before we then move to the actual presentation in this regard. So first of all, my name is Eugene De Haan. I'm the Deputy Business Executive within the Auditor-General, and I am from National D, so I'm responsible for the National Health Department, and then also all its entities. And then we have Ms. Tabello. She's the Senior Manager on the department, and she's responsible for the National Health Department. Then we also have our performance business units. Our performance business unit also help us in terms of executing some of our performance audits. So in this specific team, we have Mr. Kivesh. He's the business executive from the performance business unit. We also have Ms. Dr. Stella Oliphant. She's our medical doctor. It's also helping us in terms of reviewing the specific health compliance and also the health protocol and procedures. And then we also have Mr. Jock. Jock is also responsible for the protective, the PPE scoping area that we looked at. Then we also have Ms. Maud. Ms. Maud is from our information systems audit section. So she's also responsible for helping us in evaluating the specific case management system that we looked at from the department side. And I'm just trying to see if I've covered everybody now. If I maybe have missed somebody, but I think that is our team from the Auditor-General side. So yeah, so I just want to say that's our team from Auditor-General side that will be here present today. So we'll all be doing the presentation. We'll do our specific sections that we need to do, and we'll also be briefing the portfolio committee on these specific outcomes. And then we can take some questions towards the end of the presentation, where we can then also engage and also share a bit more detail and knowledge regarding what we've identified. I think also what is also important to note is that we've got two special reports that we've already issued that's already been tabled. And in these special reports, there are a lot more detail as to the specific province and the specific non-compliance or service delivery observations we identified. So obviously for this presentation purposes, you will get a high-level review of what we've identified. But if you need the necessary detail, then I would then recommend the portfolio committee members to please go to the actual special reports, and you can get the specific detail regarding, let's say, if you're interested in a specific province or in a specific focus area that we looked at, because that can then also provide the necessary detail the members might require for them to actually engage the departments on those specific sections. So, Honourable Chair, if you allow me, because I know we're all pressured for time as well, I don't want to waste too much of time. So I also then would with your approval, then also move forward in terms of us actually moving into the presentation. I don't know if there's any further questions from your side, Chair, or before I can move forward in the presentation.
Please go ahead. Please go ahead, Eugene. Thank you.
Thank you. So I think, Tabelo, if you could just share presentation. Thank you very much. So like I mentioned, what we are doing, we're looking at Special Report 1 and 2. So we combined these two areas together so that we can also then share in totality the specific outcomes of these two special reports that we've already issued. So we move to the next slide, Tabelo. Again, to the next one, please. So obviously, we've taken a comprehensive, multi-phased and a risk-based audit of these key initiatives that the government is actually instituting regarding COVID relief funding. So just to give a bit of background, and then for the specific health, we also then looked at, in terms of those 4 focus areas at the bottom there, we looked at the purchase and distribution of the PPE, which is your protective equipment. We also then looked at the purchase, distribution, or maintenance of the ventilating devices. And we also looked at community screening and testing, and we also looked at the capacitation of hospitalization of the hospital beds through the erection of field hospitals. Those were the main 4 categories that we are scoping areas that we looked at. So during these audits, what we also did is we looked at a 3-component approach. So first of all, we looked at what prevention does the department have in terms of, so what is the preventative controls that the department have in place? And if they don't have in place, then what is the preventive controls we can suggest to the department for them to actually have in place? So we had some interactions with some of the accounting officers and some of the executive authorities, where we actually shared our best practice and best knowledge for them to actually be well prepared as to how they're going to distribute the specific funds. Then the second component of the audit is then the detection phase, or the detection component of the audit. In this area, we follow the normal audit approach, where we will go and identify high-risk areas or significant payments, and then we will go and actually develop specific audit procedures for us to go and identify, test, and also determine whether or not those payments were done in terms of the necessary legislation and compliance that is required. We also then moved forward in terms of reporting these findings to the accounting officers and authorities, and we also then got some input back from them as to whether or not how they're going to deal with these matters, or what are specific weaknesses and internal controls they need to strengthen moving forward. Then the third phase was the reporting phase, where we just report these specific audits in the special reports, as what I've mentioned. To date, we've done 2 special reports regarding the specific COVID funding. Okay, to the next slide, please. So again, the focus of the audit. So what is important to note is that the auditees that we looked at, so who did we actually apply this audit to? We actually looked at the National Department of Health. We looked at all 9 provinces in terms of the provincial departments of health, and then we also looked at the National Health Laboratory Services. And then at the bottom of the slide, you will notice there that the allocated budget for that was earmarked to the health sector regarding the COVID funding was roughly about 22 billion. And then we then also did an indication to see whether or not how much of that 22 billion has actually been expensed to date. So you'll see the dark blue refers to up to end of July, about 6.4 billion was expensed in the health sector. And then if you look at towards the end of September, another 5.3 billion was expensed, which then comes to a total of 11.8 billion of that 22 billion, which are roughly about 50% of the budget has then been expensed at the end of September. Then again, to come back to our main focus areas on the right-hand side of the slide, like I mentioned earlier, we looked at specifically at the PPE, the purchase and distribution of your protective equipment. We also looked specifically at the community screening and testing. And then again, we looked at the capacitation of hospital beds through erection of field hospitals. And then we also looked at an additional area just in terms of other expenditure, other medical related expenditure, and those procurement processes regarding that specific expenditure. So then what we also did is from our side, we also raised in specific audit observations or findings in our special report 1 for the different provinces. And then what we also did is when we went back to the special report 2, we also followed up on some of those specific audit observations and findings that we actually identified. And the ones in green you will see, or the ones that says implemented, those are the ones that are all from our follow-up, those accounting officers for those specific provinces have actually then followed it up and implemented those specific findings. So they've done some actions against them. And then in the right-hand side, you'll see the red and the orange. The orange meaning the fact that they're still in progress when we were busy following it up. But the red is the two that we need to maybe just look at a little bit, because what we identified at Eastern Cape and Northwest is we found that some of these findings that we've actually raised have not yet been addressed.
Eugene,
Sorry, Chairperson, there's noise here.
We are presenting next to the kitchen, Eugene. Can you move a bit? Yes, I can see you.
Sorry, Chair. Yeah.
Right. Yeah, it's breakfast time for your family, not for us. Okay, thank you.
Yeah, sorry about that. It's just the winter upon us. One of the little ones is a little bit sick, so we're trying to not expose the other kids at school. Sorry about that. So from our observation, we then identified that Eastern Cape and Northwest, we found that for the Eastern Cape Department, we identified some specific weaknesses and some specific potential fraud risks in their system. And when we went back to actually go and follow up, we found that some of these matters have not yet been addressed. But we did also then have a discussion with the CFO, and then where the CFO then also mentioned that at this point in process, they've also then stopped all manual processes. And then they have actually then implemented some additional internal controls to try and also address some of the specific fraud risks that we've identified. And go to the next one, please, Tabelo. So then regarding the Northwest, with the Northwest.
And we get so much noise coming through. Number two, why is there not applicable for Limpopo and the National Department? Please include that in your presentation so that you don't have to come back. I don't want to interrupt you, but there must be a reason for you writing not applicable there.
What I'll do is I will just hand over to Tabelo for her to just touch on those two questions from you, Chair, and then we can move forward in terms of the specific focus areas. Thank you very much.
Thank you, Eugene. Chair, to answer your question now with the not applicable, if you look at the top of the table, under key commitments received, there was a section that talks about which commitments was implemented, and the next section talks to which commitments was either in progress or not implemented. So on the table where you see a not applicable, we were saying, for example, with the Free State, with the findings that we raised, there was no commitments that the management had implemented, and hence all the commitments that we had indicated were sitting under in progress. And if I then move to Mpumalanga, it was the same case where, and Western Cape, where what we had raised at the point of us following up, they were still in progress with the commitments that they had committed to follow. And with Limpopo and National Department of Health, there is not applicable because the commitments that they had committed to do, they actually did implement them, and hence you see a not applicable under in progress or not implemented, where else there is information under implemented. Thank you, Chair.
Are you done with the presentations on both the report 1 and 2?
No, Chair, I was just responding to the question on not applicable. We can
okay.
hand over to the rest of our colleagues to continue with the presentation.
Please do.
Good morning, Chairperson, colleagues, members. Thank you for the opportunity. Excuse me, and Eugene, that introduced me. My name is Jock. I was part of the team involved with the audit of PPE for healthcare workers. So I would just like to share with you some of our observations and some of the findings we've identified as contained in Special Report 1 and 2. We'll start with the first one, which is the value chain. And just to give you a brief background here, so this is the ideal value chain. When one looks at PPE itself, how that moves through the system and how it then ends up with healthcare facilities. We start first of all there where you can see the needs analysis for PPE. And what we mean by that is where the departments, they sit back and say, how much PPE do we need? How much money do we have to buy PPE? To how many healthcare facilities do we need to distribute PPE to? And that's the forecasting and all those demand analysis and needs analysis that needs to be done. That then goes to the next part where it says obtain PPE. So now the department, they can obtain PPE either through procurement, buying it through quotations, buying it from transversal contract suppliers, or they can get it from via donations. There are many benefactors out there that even during this pandemic donated PPE to the departments as well. Then the third part is when they receive that PPE, they now have to go and store it. So that is where the bulk warehousing comes in. So during the audit, we identified that PPE was stored in bulk at 17 bulk facilities. It was 7 existing medical depots. And for purposes of the pandemic and the mass storing of PPE, they also used 10 temporary facilities. So it was 17 in total. Now, from the bulk warehouse, it is now then distributed to the healthcare facilities. Your healthcare facilities would request PPE from the bulk warehouses, and it is then distributed to the various healthcare facilities. So in our audit, we visited 36 facilities, 24 hospitals, and 12 primary healthcare facilities, like your clinics. And then the last part is where the PPE then arrives at these healthcare facilities, and where we looked at the use and disposal. So basically, when they get the PPE, is it being used? Is it not just being hoarded there at the facility? And also when it's being used, how is that PPE being disposed of? It should be appropriately disposed of because there's always the risk of transmission of COVID if it's not appropriately disposed of. So that is a part of the work we've conducted. And this describes the whole value chain of PPE, the ideal value chain. If we go to the next slide, it is where we can then just discuss some of the findings we've identified as contained in Special Report 1. Now, our key audit observations there, I'll be speaking to numbers 1 and 2, and my colleague Tabalo, she will deal with the rest of these findings from 3.1 to 3.9 at the end when she speaks about supply chain issues. For the benefit of the members, so I'll speak about finding number 1 and 2. If the members want the detail of these findings, it can be found on pages 60 to 70 of Special Report 1, 60 to 70 on Special Report 1. The first finding there, which we identified at 7 provinces, was that PPE items were not ordered at prices regarded by the National Treasury as market-related. In other words, National Treasury has set a certain benchmark. They've got instruction notes with certain set prices, minimum, maximum prices, and we compared a sample of the PPE that was procured against these, and we found deviations in that regard at 7 of the provinces. The second issue is that we identified was at 6 provinces, extended lead times to deliver PPE. Now, in simple terms, a lead time, what it is when you place an order with a supplier, day number 1 starts. As soon as you place that order, you've made a commitment with that supplier. When it's then delivered, let's say 23, 25, 30 days later, that is the lead time. So there are certain ideal lead times. For example, for if one looks at transversal suppliers, they normally take about 14 to 21 days, and on quotation, normally about 21 to 22 days. So those are deviations that we found, that some of these lead times exceeded those benchmarks. Then, as I said, Tabalo will deal with 3.1 to 3.9. We can then move on to Special Report 2. And Special Report 2, numbers 1 to 13 again.
No. We are not rushing to such an extent that you don't want to take us to the 3.1 and whatever that is there. You talked about 1 and 2 only. Please say something about those 3.1 to 3.9.
Certainly, Chair. I'll hand over to Tabalo. She can do it now or at the end, whichever you prefer. We can deal with it now as well. Then Tabalo can quickly deal with those. Tabalo, I'm not sure whether you will want to deal with 3.1 to 3.9 now, or would you prefer dealing with it at the end?
No, we'll be so much confused. Deal with the slide as it to the completion. Deal with it now.
All right. Thank you, Chairperson.
Thank you, Chair.
Thank you, Chair. The way we had set up the findings, we had followed the focus areas that we had, where you see the findings have a section on PPE, then a section on committee screening and for field hospital. So both those focus areas has findings from where our experts assisted us with some of the work, and this is where Jack is coming in. And then there's findings where us as the regulatory team looked at the procurement processes. So as Jack indicated, in Special Report 1 for PPE, the regulatory team looked at the procurement processes for the PPE, and this is listed in, as you can see on the screen, is finding 3.1 to 3.9. So finding 3.1 to 3.9 highlights the procurement processes challenges that were identified and raised during the audit. If you can note on the column that says Province Chair, you'd note that there's KZN, GP, and Northwest. At the point of reporting SR1, the rest of the provinces were fairly behind with the work, and only those provinces had covered ground. And that's why you are seeing a lot of findings here only from the 3 provinces. When we look to the next slide on SR2, you will then see that the other findings are coming through for the procurement processes. So the majority of the findings really, if we can just provide insight to the procurement processes, what we could see is the administration really didn't go well off the whole procurement process that they were doing. So either maybe the departments were much in a hurry, and a lot of things really fell through the cracks. For example, if you look at finding 3.1 on the screen, talking about specification not indicated on the awards, these are things that we usually expect them to get right while they are actually doing normal procurement processes. But what we saw with the pressure for responding to the pandemic, some of these processes fell through the cracks, and unfortunately some of these findings then will result in irregular expenditure. So we had instances where, for example, there was insufficient controls over the receiving of goods that was ordered. There were instances where some of the suppliers where they were contracting with, the tax related matters were not fine with SARS, and then some of it, there was no evidence or proper approval for the deviations that of the procurement that they were currently procuring. So these are the issues where unfortunately things went wrong in SR1 is in these provinces, and then we raised the finding. I think one thing I really want to highlight is not all of this finding resulted in any loss. Some of them resulted just in irregular expenditure, which management committed to investigate and implement necessary consequence management. But however, from finding 3.5 on the slide, this is where we saw possible financial losses, because what we saw is very much linked to finding one where they were procuring at prices that were higher than the instruction notes that were issued by National Treasury. So what happened was the feedback really we're getting from them is because of the pressure to get the PPE into the system to make sure that there's no shortage, some of the departments were accepting prices that were higher than the National Treasury guidelines. What we're doing now is the team is following up now with the 2020-2021 audit to see what investigation had taken place and to see if there's any possible financial losses that have been lost and if there's any need for us to then trigger an MI process. So I will then move to the next slide with SR2 as well. It starts with the procurement and contract management. So with the time we're tabling SR2, a lot of provinces had now covered ground from an audit point of view, and that's why on slide 13 you are seeing Eastern Cape is also coming through, Northern Cape was coming through as well as Limpopo. But what we see, Chair, on the column that says repeat finding, it's a yes. What we note is the findings that we reported in the first special report were coming through again in the second special report. It might not necessarily be in the same province, but within the sector, we're picking up the same challenges or deficiencies that we had indicated in special report 1. For example, when you look at finding 1.1, where there were deviations from the procurement process, but the reasons for deviations were not properly documented, and some of those deviations were not approved by the necessary level, which in these cases it was supposed to be the DG. We also once again saw the fact that there was tax-related matters that were coming through, and then they were also again on 1.5 a specification not indicated on quotations. So it then goes back to the point I mentioned earlier that the administration of the procurement process during the pandemic was not run well, that a lot of things were falling through the cracks. And unfortunately, some of the things falling through the cracks were triggering non-compliance, which resulted into irregular expenditure. I think I'm going to highlight also 1.9, which is the limitation of scope, where when we were requesting some of the information from them, the packs that were coming through didn't have some information, which means that also their filing processes while they were busy procuring was not up to scratch, that some information was missing. So we could not tell whether it's a matter of the information was not received from the service providers that they were contacting, or it's a matter of the fact that the filing process was not fine and the information was lying somewhere within the department. So I'm also then going to move to the next slide, which is slide 14. That talks to some of the findings around procurement, where if we look at the observation number 10 and 11, which links to finding 2.1 and 2.2 on SR2, we saw that there were awards that were granted to suppliers that were part of a joint venture, but at the point when the supplier bidded, they had a joint venture, but when they awarded, the award was only given to one person. So that we also raised that from Northern Cape. And then some internal control deficiencies that we noted was the insufficient controls over receiving of goods and services. The other point that I want to draw the committee is when you look at funding 12 and 13, you see there's Free State Provincial Treasury coming through. So what happened in Free State was that the Provincial Treasury was procuring centrally for the province, and then they were then distributing to the different departments within the provinces. So from a health point of view, there was no findings that you see coming through relating to Free State. However, in SR2, we then also included Free State Provincial Treasury so that we can audit and look at the PPE procurement processes. And hence, in this slide, you start seeing Free State Provincial Treasury coming through as some of the findings. I will hand back to Jacques to then talk to the service delivery part from SR2, which is from part 14 of the slides. Jacques, over to you.
Thank you, Tabalu. Yes, Chairperson. So I'll be dealing with numbers 14 to 19. And again, for the benefit of the members, these issues can be found, or the detail of this can be found in Special Report 2 and on pages 102 to 109, where these detail of these findings are contained. So if one looks at number 14 there, the first issue that we identified with regard to the recording and storage of PPE was at 5 of the provinces we identified that systems and controls to account for PPE was not in place, was not effectively used. In other words, these bulk storage facilities did not always have a system to account for PPE. For example, stock cards. When PPE comes in, it should ideally be recorded on a stock card. It can be electronically recorded, it can be manually recorded, but ideally it should show the flow of that PPE coming in. In other words, I've received 10 masks, so my quantity matches, at stock level 10 masks. If I then issue 5, there should be 5 left. And these systems were not always in place. We did find that there were systems at some of these storage facilities, but they were not necessarily effectively used. So, and as I indicated, we identified deficiencies at 5 of the provinces with regard to that. The second issue is at number 15, where we identified that PPE was not always distributed in a complete and timely manner to healthcare facilities. In other words, when healthcare facilities need PPE, they would request those PPE from the bulk store. And the bulk store would then dispatch PPE to the healthcare facilities. But what we found is that sometimes the bulk store did not have sufficient quantities of PPE in stock, so they were not able to distribute PPE to the healthcare facilities, or they would distribute it in parts, in reduced quantities. If you want 10 masks, they will only send 5, for example. So we identified that as well. And that obviously has got a detrimental effect then at the healthcare facility itself when they don't have PPE in stock. The third one at number 16, where we identified poor storage practices at the bulk store and as well as the healthcare facilities which we visited. And in that regard, we identified issues at 8 of the provinces. If we say poor storage practices, we identified that stock, for example, or PPE boxes were stored on top of one another. Some were stored in the offices of personnel, in walkways. They were open, some of the boxes. They were not securely stored. So we identified a number of issues with regard to that. And I will take you through some photos later on the next page. Now, and at number 17, at 4 of the provinces, we identified that there were limited security controls at the bulk stores. So at the bulk stores where they store the majority of the PPE when it comes in. Mostly these issues were identified at the temporary facilities. Because it was only deemed to be temporary, the departments did not necessarily upgrade the security at these facilities. And your risk with that is if you don't have sufficient access controls, anyone can walk into that bulk store. And the problem with that, again, is it creates a risk of misappropriation of PPE or even possibly of theft of PPE. So at 4 provinces, we identified issues with that. Then at number 18, we identified examples at 7 provinces where PPE did not meet the required standards and or specifications. In other words, we identified that some PPE that came in that was ordered did not match the required quality. They were of very poor quality. Or it wasn't exactly what the department ordered. For example, they would order an N95 mask, but they would then be provided with a KN95 mask, which is not the same. As I mentioned, some of the quality of the PPE was also not up to standard. Then on the next page, at number 19, we identified that 1 province that there were payments made for goods and services where there was no evidence of delivery. That was identified in 1 of the provinces. I would just like to take you to the photos there at the bottom. There are 3 pictures in there. And as I alluded to in the previous slide, these are examples of poor storage practices of PPE. As you can see with picture 1, the PPE there is stored in the walkways, outside the boxes, and on top of each other. You can see it's in a very disorderly manner. When PPE is stored like this, it makes it very difficult for people, let's say, working at these bulk stores to retrieve PPE or even to account for PPE if it's stored in a disorderly manner like this. In picture 2, their PPE was stored at a temporary facility. But because the infrastructure at that facility was not well maintained, the roof, for example, suffered water damage and that water leaked through. And you could see the damage that was caused to the PPE because of water seepage that came through the ceiling. And then the third picture there, where you can see that PPE stock was stored outside a bulk storage facility, not inside the facility. And Because of this, and in those crates there, you could see it was sanitizers. And because it was stored outside, it was exposed to sun and rain, and some of these items were damaged because of exposure to the sun and the harsh conditions outside. And that unfortunately resulted then in the integrity and the quality of, being compromised of that PPE. I think from my side, I'm done to battle with my sections. I will then hand over and hand back to Eugene. Thank you very much for the opportunity, Chairperson.
Thank you very much, Jock. I think we're going to move forward now with Tabelo moving and with Maud moving on the specific case management system, and also Dr. Oliphant moving in terms of the community testing. Thank you very much for the second focus area. Thank you.
All right. Thank you, Eugene. Good morning, Chair, and the members. Thank you for the opportunity. So I'll take you through the community testing and case management solution. So with the value chain, what we planned to do was to start at the provinces where the community screening and testing was happening. And if you have symptoms, then you'll be referred for testing, and that's where NHLS will come in. However, from IT perspective, our concentration was more on reporting, where we were covering the case management system. So just to give a bit of background, when we started with SR1, the system that we knew of at that time was the data lake system, which is at NDOH, which is used for reporting the stats for the COVID infections. However, as we're doing more understanding of the processes, we identified that it's not only one system. However, there are a number of systems that are there to track the stats. So where it starts at NHLS. There's a system called Track Care there, where the data is being captured. So the data that's being captured will be your ID number, obviously the name of the person, the contact number, the address, and the results. Then from there, the information will move to a system called Bluebird. And this system is used to standardize the data format, meaning the data coming from the different labs. What I did not mention on the track care is on the labs, the information is captured at both public and private labs. Then from the Bluebird, the information moves to NDOH, to the system called Data Lake, which then is used for reporting. However, there is another system called Track and Trace, which is BCX Telecom system, which is used to send those SMSs to the public to say when you tested positive for COVID. The other system that was identified is the system that's used at the hospitals called DataCoff. So moving to the next slide, where we are reporting on the findings. As I stated, I mentioned that when we started with the audit, it was just data lake that we concentrated on. So the findings that were raised for data lake system was the cost of potential future software licenses fees unknown. Reason for that is when we looked at the contract that we had. On the contract, the agreement was up until 31st of March 2020, and it did not specify to say after that what will happen to the software licenses. You see when you go to SR2, this finding is no longer there, because when we followed up, we found that the contract ended 31st of March 2020. The other thing that was identified on the data lake system during SR1 was, when you look at the contract or service level agreement, there was no provision for data backup management process, which is critical, because if you lose the information on data lake, what's going to happen? Because as public, we still need to know what's happening with the infections, the numbers, and all of that. And then thirdly is no provision for change management process in the service level agreement. Again here, it was on data lake. So what we are basically saying here is the changes that are made on data lake, there was no process or formal process that was defined on SLA, as in how will those be handled, who's going to authorize those changes, and how are they going to be implemented onto the system. So those were the issues that were identified for SR1. If we move to SR2 findings, I will do finding 2 and 3 on this one, because those are the ones that relate to IT. So looking at these different systems that are there, what was identified is there was basically lack of IT project management governance and system implementation controls, meaning that when these systems were developed, number one, there was no business case that was provided to us to say this is why the system was developed. And as well, when we were doing the audit, we struggled to get someone that's accountable for the systems that were developed. And as well, when we were looking at the document that will detail exactly what is it that will be developed, we'll call it the specifications on the system, we could not find the documents relating to that. And as well with the actual implementation on the system, where we find that the testing, we couldn't find evidence that testing was done before the systems went live. There was just no documentation around the system, which might cause problems where any updates needs to be done on the system, because the people that will be doing the updates wouldn't know where to start to update the system. And as well, there was lack of system controls. So system controls will refer to the input controls on the system. By that, I mean, for example, when you are capturing the information, I'll start from NHLS. So the like ID numbers, contact numbers, address, and all of that, it needs to be captured. So on the system, there wasn't enough validation to ensure that no processing can be done if that information is not there. And as a result, when we were moving through the value chain of the systems now, what we have identified is when you get to Bluebird and you compare the system, the information system, the information sitting on the Bluebird versus the system sitting in NHLS, there were gaps there. And also when you get to that data lake as well, and you try to compare the system, the information sitting on data lake versus what was actually captured on NHLS, there were gaps. However, you'll see we have also noted that even though there are those gaps within the system, right? There are manual intervention which compensates the deficiencies in the system. What I mean there is at NDOA, it starts at the Bluebird when they're cleaning the system. When they see that there are gaps in the information, what they do is they now need to start calling the labs to verify the information, and that it's not efficient way of doing things. Ideally, when you capture from NHLS, the information should be captured, and there should be validations to ensure that the information that's captured is accurate and complete at that particular time. Thank you.
Good morning, Chair and colleagues. Thanks, Tabelo. I'll be talking on the temporary quarantine facilities as well as the field hospitals. Tabelo, the next slide, please. On the scope of work that we looked at for the temporary quarantine facilities and field hospitals, we looked at how the need was determined, and that was based on also how was the planning done and prioritized based on what the need was identified. We looked at how the budgeting for these facilities were done, as well as procurement, going into appointment of contractors, as well as looking at then the implementation of the project, looking at key project management principles around the costing of the project, whether there were any variation orders, the quality aspects of the project, as well as then the planning, commissioning and utilization of the facilities after the projects had been completed. The next slide, Tabelo. Some of the key audit observations from Special Report 1, the first areas that we've highlighted was on procurement of the quarantine sites and field hospitals, which was tested against the current Treasury regulations. At the date of Special Report 1, we looked at 16 contracts with a value of about 573 million. The key findings raised were in the KZN province. Finding 1 is based on where needs assessments and evaluation of major capital projects were not performed. The second one related to declaration of interests that were not included in the procurement documents. And the third one was where the awarded supplier was not tax compliant at the date of the award. The next slide, Tabelo, slide 27. This is for Special Report 2, where we went further into the procedures around the field hospitals. The first procurement and contract management issues identified was that there was standard bid documentation that was not included in the procurement documents that were provided, and that was specific for the Department of Health in KZN, as well as Gauteng Public Works. Also, there was unfair procurement processes as bids were not invited, and that was applicable to KZN and Gauteng as well. And on the last issue identified under procurement was that the total payments made under the contract exceeded the contract price, and that was applicable to KZN. I'll move on to implementation and commissioning. From the implementation and commissioning, we had visited 8 facilities. Of the 8 facilities, there were 2 key findings coming out in 2 of the provinces. The first one related to 9.1, which was the Free State, the Bloemfontein Showgrounds. The key issues they highlighted, firstly, was that there was a delay in completion of the field hospital. And here we have where the planned completion date was to be, I think it was the 30th of July 2020, but the work when work commenced on site, it only commenced on 27th of July. So they then revised the completion date to the 31st of August 2020. When we followed up on this project in September, the project was still running in progress. One of the other key areas highlighted for Bloemfontein Showgrounds was on the lease agreement, where the monthly rental was approximately R500,000 per month. And the lease stipulated that the monthly rental and the administration fee for August would be payable before occupation of the premises. So essentially what that meant was, even before the facility had been commissioned and utilized, the department was incurring a rental on the facility. I'll move on to the KZN, where it was the Clearwood Temporary Field Hospital that we looked at. At Clearwood, the key issue there was on the project costing, where there was no evidence provided for the approval and breakdown of the project costs. So unfortunately, the department couldn't provide us with evidence on how the project costs were broken down and determined. We also had issues around the request for proposals, where it wasn't invited to a broader spectrum of suppliers to obtain a more market-related analysis. There were only 3 suppliers that were approached, and each one of them had then received a contract for each of those facilities. At the time, there were 3 projects that KZN was doing at the time. The other one was on the project delays. For KZN, also there was a delay based on the air conditioning unit that had to be upgraded, and that contributed significantly to a delay on the facility. And the last issue identified was on the quality of the work that was done at the facility. Whilst there were project snags, which was identified, over and above that, there were also issues identified. Some of them were based on the leaks that was still experienced at the facility, which still needed to be fixed. So for SR2, the teams are in the process of following up on the current status of these field hospitals. I think that's all from my side. Over to you, Tabelo. Thank you.
Thank you, Bilkish. I'm going to be taking through the committee the rest of the slides. The last area that we looked at as well was the other expenditure. When Eugene was doing the introduction, he did indicate that there's other expenditure. And in this section really is where instances where, while we had said we had 4 focus areas, as we were auditing and we identify under areas that had possible risk, we were also considering it so that we don't miss a significant risk. So in special report 1, there was one finding that was raised in Northwest, and the finding was really around advertisement, because we did note the fact that even though the sector was focusing on procuring PPE, there was also field hospitals, but there were also other support services that they were procuring, which is like advertising and communications, that we did look at to make sure that they are also complying with the current National Treasury regulation. So there was a finding in Northwest where they were not procuring against the National Treasury regulations, and where there was deviation, they were not reported to the provincial treasury within 30 days. In SR2, we did not include any findings under other expenditure, and this was because there was a lot of work that was being done on the main focus areas. In conclusion, Chair, what we really saw in SR1 and SR2, there was findings around PPE procurement processes, which was of a concern to us, where we noted in a number of instances where, as you mentioned earlier, that the competitive process was not being followed as provided by the guidance by National Treasury, and as such, specific the suppliers were then receiving the contracts or awarded the contracts, and then this really didn't support the competitiveness spirit that we supposed to be applying in the country. We also saw instances where some procurement was not favoring local producers, so they were not complying with the local content requirement in some procurement processes, and like indicated earlier, some contractors were awarded where their tax affairs were not in order according to SARS. We also saw some form of discrimination amongst the evaluation of the procurement process. I think this was also coming through a lot of finding in Limpopo, where we saw some suppliers were disqualified based on not complying requirements, whereas other suppliers were not disqualified, whereas they were also not complying with certain requirements. We also saw that there was a number of suppliers that were new in the industry. And I think with this one, we do raise it with caution, Chair. We do know that some of the suppliers were able to deliver, but when we were raising it as an observation, we were saying it really exposes the sector to a risk of non-delivery if they are awarding contracts to businesses that really does not have experience in the industry. And I think some of the lead times that were highlighted earlier by our teams could have resulted with the fact that some of the suppliers do not have history in providing PPE. Under our PPE still for quality, price and delivery, it was highlighted as well that some of the PPE was procured at prices that were higher than market-related rates. And as indicated earlier, again, the teams are following up in instances where there is possible financial losses, as you would be aware that with a material irregularity, if there's possible financial losses, we can trigger a material regulatory process. So for these instances where there were potential financial losses suffered by the sector, the RA teams now with the 2021 audit, they are following up to ensure that in instances where there is a need to issue material irregularity, they are going to issue it. So we should really look at to the outcomes of the 2021 audits where there could be a number of possible material irregularities coming through on this one. As indicated earlier as well, some suppliers delivered PPE that did not meet the required specification. I think Jacques, my colleague, really dealt with that in detail. And also some suppliers did not deliver on time, which then impacted on the service delivery. There was a number of poor contract management and significant deficiencies that we identified in the ordering and the delivering and the receipt, and also the payment processes. I know in this special report, KZN was also one of the provinces that really raised this finding a lot, that there were poor controls around the receipt of the PPE that was ordered. My colleague Jacques also, Chair, highlighted the issue under Ppe Storage and Distribution, and where we were saying this the ineffective storage processes really had an impact and could result in possible losses, as we saw in the pictures that were showing that if the PPE is not stored correctly, there is a possibility that there could be some losses due to the PPE that could not be utilized later. Under field hospitals, my colleague also just highlighted the findings that we raised around the appointment processes. I think one thing that I want to highlight is what we saw with PPE. National Treasury released a lot of guidance around PPE, but there was really no guidance around procurement of or contracting of field hospitals. So the provinces had to still use the guidances that existed, that Treasury had issued. And even in those instances, we did see a number of non-compliances with the appointment processes. And then the approval were in instances where they were deviating, some of the people deviating really were not of the correct delegation level. Overall, Chair, when we really see the findings we saw in SR1, SR2, in SR2, we did further identify several weaknesses in the control environment. We do also take note that management might not have sufficient time to really follow up on our commitments because they were still preoccupied with dealing with the pandemic. But we are hoping that when we do follow up now with the 2021, that there would have been much work done with regards to the recommendations that we did issue. The accounting officers did commit to implement our internal controls, and they did commit to investigating instances where we were raising non-compliance that was resulting in irregular expenditure of losses. So like I said, the outcome of this audit in the current year would really give us a very good picture of how far the sector has gone with regards to dealing with the internal control deficiencies that has been reported both in SR1 and SR2. That is the end of our slide, Chair. I'll hand it over back to you.
Thank you very much, Tim from the AG. Let me raise my criticism on your presentation. I maybe because of my age and the school of thought, I have always known that you write black on white or white on black, Thapelo. Now, if you write white on brown, there's a big challenge for some of us to read. Number two, I do notice that this presentation is an extract from your report. I would request in future that you take an extract from your report and actually improve the font and actually improve so that you can read and find that it is easy to read than to do. I'm wearing glasses, but I had challenges to read some of the slides. Lastly, of all the presentations that you have made, the best person who took us through well was Miss Bilkish. She was reading, saying, now I am doing PPE in KZN, and I'm on point what? And she was reading what is written there. She was not really, because we're now juggling between, should we read what is on the slide or should we listen to the presenter? With her, she was reading the slide with us, and therefore you could actually tell. That's a challenge now because as we were closing up, Thapelo, you were actually making examples of this province and this province on that point and that point. Now, that is not on your slides. How do we go back now to then say that point made with regards to like these last ones on KZN, that was not shown in your slides. So we do have a challenge. I do know that maybe we want to have a colorful book, but sometimes it's really difficult to read white on brown and a small print the way it is. It is difficult to really. Please be accommodative of most of the other people who may not be able to read such small fonts. I now open up for members to engage, and I do have a list of the honorable members to start. Let me just come to that. There are 5 so far. Okay, and then Mamshel has just joined in as number 6. The first one is going to engage the presentation is Honorable Van Staden, followed by Honorable Sokacha. The third is Honorable Kwahube. Fourth, Honorable Dr. Tembekwayo. I have received now Honorable number 5, Honorable Wilson, and the last one on this list so far, Honorable Mama Ohlengwa. None of other names have come through yet. So let's start in that order.
Thank you, Honorable Chairperson. Good morning to the Auditor General and all honorable members. Yeah, I'm actually glad that I wasn't stuck in traffic this morning because what we saw now is a bit shocking and problematic. I'm going to start with slide 6, the blocks which was mentioned in a red there. I just want to ask the Auditor General for clarity on this one. Why is the Eastern Cape Department not agree with over-identified control weaknesses? Can you just elaborate a bit more on this matter, please? And then I'm on slide 11 and slide 27.
Sorry, Drafan. Can we just be reminded, is it possible for the presenters as we get the question to bring back that slide that the honorable member is talking to, and then we do it that way because we can't recall well in that way. Please, if it is possible. Starting with slide 6.
Yeah, slide 6, I've asked a question, but let's bring it up. Yeah, on the right-hand side, that block in red there, My question is, why has the Eastern Cape Department not agree with all the identified control weaknesses? Can the AG elaborate a bit more on this matter? Then slide 11 and slide 27, I'm going to talk to you about now. And I just want to ask the Auditor-General on that.
Hold on, Honorable Van Staden. Can we go back to slide number 6? I want to specifically request Eugene, can you read what is there in red? Because all I could tell you was that there's a red with the Eastern Cape, but what is written there, I don't know how I'm going to read it. Can you read for us? What do you say? I know Honorable Van Staden was able to pick up that did not agree. I just couldn't see what you have written there. Read for us.
Okay. Thank you, Chair. I think, first of all, let me just apologize for the presentation. We do take note of your comments. We'll definitely make it a bit more user-friendly next time. We really do apologize for the fact that the presentation didn't come out as what we intended it to. So we'll definitely make sure we do rectify this. And I just want to say apology to the members and to you, Chair. But basically, what we're mentioning there is to say that the department did not agree with all the identified internal control weaknesses in relation to possible fraud risks, but have started improving some controls. In some instances, the control weaknesses have led to actual transactions. Therefore, the CFO instructed that manual orders may no longer be issued. The completeness and accuracy of the asset register, as well as the appropriate classification of COVID-19 expenditure, will be audited as part of 2019-20. So I think maybe just to address the member's question, you will see.
No, don't answer the question
when we go now.
Don't answer the question now.
Okay.
He's still on the floor. I wanted just to say, as he's asking, please bring the slide that he's talking to, then you can see what is up. Thank you very much. Move, Honorable Van Staden.
Thank you, Chairperson. So I just want the AG to elaborate a bit more on that matter after I've finished my questions. And then I'm speaking now on slide 11 and slide 27. I've put the two together. And my question to the Auditor-General in these two matters is, I want to know if it's the Auditor-General's view that all of these provinces went outside the normal procurement procedures and make basically misuse of the Disaster Management Act to procure these PPEs outside the normal market-related prices. If we can go to slide 15. Yeah, just stop there. Chairperson, I think what we saw here this morning is a bit disturbing, and it makes one, it's a shame to saw this kind of pictures. And Chairperson, I think this committee must intervene in this kind of matters. It is, in my view, it is totally unacceptable. While we're in the middle of a high-level pandemic last year, and that we have a great shortages of PPEs last year and other medical equipment. We saw now these kind of pictures this morning of PPEs not handled with care, any care at all. I think this is a shame. I think this is disgusting. 8 of the 9 provinces. There's 8 of 9 provinces who did this. And I think we cannot, as a committee, let this matter stand here. We must take action on this. This is totally unacceptable. And the heads must start rolling in these provinces and these departments for handling shortage, the PPEs. We had a great shortage of last year in the middle of a pandemic. And we saw pictures like this now, this morning, of PPEs who stored in walkways, outside boxes on top of each other, stored outside in the rain, under temporary bulk storage. I think it's totally unacceptable. And I want to ask for Auditor-General. I want to know this morning, who are these hospitals who did this? We want the names of these culprits. So please, Chairperson, I request you this morning that we as a committee must intervene in this matter. This is totally unacceptable to see stuff like this. Thank you very much.
AG, if you show us pictures like this and there is no name, this is what you go and buy in a supermarket, a no-name product. These pictures must have was, yes, this is part of South Africa, but it's not all 600 clinics, is not all 200 hospitals. You need to name, and that's what actually we are going to go to you to request. And the report then will be user-friendly to us, because we are not going to be like looking for a needle in a haystack. We just know where this happened, and maybe you'll answer that when you get this. But this is actually one of the challenges that we face with the presentation of something that is grossly not acceptable, but without a name, rather than to, I would avoid that we make generalizations and say all 300 hospitals, all 600 clinics in the country have got this picture. Name and shame these things to us. Thank you. Move to the next.
Thank you, Chairperson.
Thank you very much, Chairperson. Chair, I really must indicate that this PPE procurement is a disgrace and a very disappointing, issue to listen to the Auditor General. I just want to check, I've got one question, Chair. Given the more powers that are given to the Auditor General, powers like they can refer issues to the law enforcement agencies. If you listen to this procurement of PPEs, you can see a lot of irregularities, ranging from not adhering to treasury regulations, not adhering to regulations, storage, not adhering to proper deviations, the standard of the PPEs, not, accounting for these PPEs. It's a lot of irregularities, Chair. I just want to check from the Auditor General, is there any issues that they have referred to the law enforcement agencies, because they've got that power? Parliament has given them those powers. They can do that. Is there any province or any, official that they've referred to the law enforcement agencies? Thank you very much, Chairperson.
Good morning, and thank you to the team from the Auditor-General's office, and thank you for the presentation. It is possibly one of the most depressing things I've ever heard in my time in Parliament, because it actually just points to how severely broken our system is. And so really, Chair, I am struggling to even extrapolate what we would really ask clarity on, because in my view, if you go through the presentation that's been presented here this morning, the findings are quite clear, and they are really mind-blowing, because just from the PPE procurement processes, from the quality, the price, and the delivery, to storage, to field hospitals, and just the scale of the problem, from just really basic requirements that have been needed that were not met. And so, Chair, honestly, I don't have clarity-seeking questions, except to say, I don't think that we as a committee can really just accept this report and move on. I agree with Honorable Sokacha, the AG must let us know, which of the accounting officers are going to be held accountable for some of these things that are coming out from the provinces. But Chair, more importantly, I think it's absolutely crucial that we meet with the minister and the relevant MECs, and people need to account for this. This is probably the biggest insult to public finances that I've ever seen in my life. And the reality is that in as much as there was a pandemic and people were scrambling to get things done, but some of these things are basic, some of these things are deliberate, and some of these things are criminal. And honestly, I think as a committee, we need to really think and consider how we're going to take this forward, because it would be an indictment on all of us and a dereliction of our duty if we don't ask these people, the MECs and the HODs in the provinces, what happened and how these things are going to be rectified. And so I really hope that after people have asked these questions for clarity, that we can decide now on the way forward, because this cannot go on. Thank you.
Thank you, Chairperson.
Let me just come in now. Honorable members, this is giving us a guide. I doubt in the next 20 minutes, because some of us will really have to leave in the next 20 minutes, whether we'll be able to get responses. Maybe let us continue raising what we want to raise. But I think one have to go and lean towards what Ms. Kwahobe is saying, that I am very keen to get this presentation done again in the presence of the minister and DGs and HODs, and they listen to us. Firstly, they will the AG will go and improve their presentation so that everybody can see, even sitting on a resting chair far away from the computer, to see what we have written here. It must not be an extract from your report. You must bold it and make it look big. But we need to lean towards that. Before 10 o'clock, we need to agree that this matter, it's so serious that it needs a different way of handling it. But let me allow Dr. Thembekwayo, because the AG may not or may answer, but what's the use of them getting responses to us when we do not have the people who actually have been in the forefront of having this? We would have to lean towards getting this presentation redone to us with all other people who were there. Honorable Dr. Thembekwayo.
Sorry, Chair. Sorry, I'm very sorry. I'm very sorry, because I'm to express my disappointment like this. You have not included the MECs. They must also be part of this delegation.
Oh, yeah. Sorry. Okay. Yes. Okay.
Yes, please, Chairperson. Now, I'll support the member before me now. I support that the MECs must be available for this meeting, and we must come and account on this matter. Thank you, Chair.
Okay, thanks. Members,
we all support your proposal, Chairperson. I think it will be proper.
Yeah. Nevertheless, yes, nevertheless, let us continue listening to the members. So, members, we are already
also support your proposal.
Can you give me a chance to speak? You had your chance to speak.
You will get a chance, ma'am. We are already chatting away, going to assert this matter. Honorable Dr. Thembekwayo, your chance now.
Thank you, Chairperson. Unfortunately, what I wanted to say, to express it explicitly, is exactly what you said right now. But to add on what the Chairperson said, to say the disorganized way of the AG's presentation, I mean, they can't, within a certain slide, have 3 presenters coming in and out. It was confusing, definitely. I think if they can limit their presenters at least to 2, that will be fine, so that we are able to follow exactly what is being presented here, because this is one of the most very important information that we received today. So when they come again to present this, let them be orderly. And then let them change the font and everything, and exactly as the Chairperson has said. But the most important thing that I wanted to say today is what was presented today confirmed what we asked previously when the different provinces were coming to present about the PPE procurements. What was presented today really confirmed exactly that there was a lot of fraudulent behavior taking place from the national to until at the provinces, especially when regarding to this, because even though they can talk about 2 provinces, Eastern Cape and Northwest, but the problems, fraudulent behaviors happened throughout all 9 provinces, and the mistakes were mentioned from monitoring and preventing controls, the storage facilities that plays, and the pressure of procurement, where there were cracks where there was no information that supplied who was supposed to do what and how much was paid. And most important, they also discovered that the awarding of those businesses was given to inexperienced people. And that resulted into financial losses and non-deliveries of services. But my question is, I didn't hear in the presentation the recommendations of what is supposed to happen to all these officials who allowed these problems to take place. It has never been mentioned because it's about findings and who did what and so on, but we didn't hear the recommendations, very strict recommendations of what is the AG recommending should happen towards this information. So I definitely support that the minister and all those that were mentioned should be available to hear the presentation and account. And I'm happy because this presentation today will also allow us to have a different approach of accountability, because in all these provinces who were presenting their PPEs procurement, 50% of us were saying, well done, you have done the best. No, you are the best, and we recommend that you continue with the good work that was happening. Today, there's nothing good that is presented about all those provinces. So we have to take a different turn of approach towards accountability from the minister to the MECs. Thank you, Chair.
Okay, I volunteer to assist the AG to put this presentation in a way that will be acceptable to members. You have part one, if it is procurement, then you've exhausted somebody, and then part two, part three. So we can't be moving into that. I agree with Honorable Dr. Tembekwayo. It was really challenging to see what we are trying to get. Honorable members, let us make the quick points. Honorable Wilson.
Thank you, Chairperson. I was at the scene of the fire of the FH Oudendal Hospital yesterday, and it was really depressing. And I kind of thought I wasn't going to see anything quite so heartbreaking again for a while. Only to discover
an opportunity to thank you, because you went there also to support us and observe and be there for the people there. Thank you very much for that.
It's a pleasure, Chairperson. But having said that, I mean, it was really depressing, and it's the most heartbreaking story. And I really thought that I wasn't going to be that depressed again for a long time, only to discover that the AG was going to depress me even more today. Because I think, quite frankly, and my colleagues have alluded to this prior to me talking, that this is just the saddest of saddest of saddest reports. Having said that too, let me just say that I'm not surprised. If we take a look at the AG's reports on the various provinces and the Department of Health over the last years, last 4, 5, possibly financial years, time and time and time and time again, we have got bad reports on financial processes not being followed, on procurement processes not being followed, on lack of compliance, on supply chain management. This has been going on for 5 or 6 years. I'm not sure why anyone was actually expecting this to change, because it hasn't been changed in 5 years. No one's dealt with it. No one's been held accountable for those problems in those years. Staff change hands at the rate of knots. There is no control or governance in a lot of these provinces and departments. So it is not surprising that we have to get such an abysmal result today, because until such time as somebody, the minister, the MECs, or somebody in this department mans up and takes control and starts holding people accountable for such abysmal reports, including this one, nothing is going to change. It is going to continue because there is just no accountability and no action taken. But I think the biggest tragedy and the most depressing part of this entire report, and And we saw the pictures of the PPE. We've heard that there were unfair procurement practices, no surprise there. That people were awarded contracts where they registered companies just a couple of days before. But I think what really disturbs me is that there were deliveries of PPE that did not meet standards. There was deliveries of procurement that was very, very badly stored and damaged. And we were in the middle of a pandemic. Those people who were relying on that equipment were at the front line. Health workers died in their hundreds. And that is a result of what we are seeing in this report. It is tantamount in my mind, and forgive me if I sound harsh, to attempted murder. Because when you were prepared to supply that kind of equipment to health workers who were out there trying to save South Africans' lives, and some of them have died as a result of this, it is criminal to the point of attempted murder in my mind. I am very disturbed, I am very upset, and I think not only should we be having this meeting with the ministers and all the MECs, I actually think we need to take one step further and investigate criminal charges. I thank you, Chair.
Honorable members, we can still say the same things in the next meeting when we meet, because we are resolving as such. Honorable Dr. Jacobs has actually, in the interest of time, requested to withdraw his contribution, and I'll give him a double dose when we have ministers and MECs. Honorable Ismail.
Good morning, everyone, and thank you, Chair. Actually, I'm covered by my previous colleagues. This is really shocking and depressing, and the fact that we've lost so much lives is really, it's unacceptable. We need accountability, and I think the recommendations issued that was brought up is essential. Thank you, Chair. I won't speak much. I'll speak when we have everybody present at the next meeting. Thank you, Chair.
Yeah, honorable members, thank you very much. Let me then maybe suggest the following, I will, in my opening remarks tomorrow to the minister, by the way, firstly, the minister should be receiving a letter from me this afternoon regarding this, what we are resolving, that we would like to have him and his DG and the people who are the CFO and the team, also with the MECs, HODs and their CFOs in the meeting that we will convene shortly, where we all will listen to this presentation from the AG. AG, you are free to write your recommendations. As members are pointing out, their recommendations are not there. So we start your presentation, we ask, and fortunately some of us have raised questions, then we ask the AG to leave us after an hour or two, and then on that we then deal with this matter with all the leaders that we have indicated. So I will be writing a letter to the minister. So I will then be saying in my opening remarks tomorrow, Minister, as you probably are receiving or have received the letter regarding the AG's report on provinces and national on the this and that, we then would not want to get into that discussion today, which is going to be tomorrow, because we are going to be dedicating a day where this matter will be taken through. So that tomorrow we then focus on other things, the presentation of the APP from the department, together with what we have heard from other entities, and leave this matter out completely for a day when we'll have it done. I see Honorable Van Staden wants to add on the summary.
Thank you, Chairperson. Now, just a suggestion from my side. I know the department is before us tomorrow morning, but if the minister or all these 8 MECs or CFOs or whoever cannot make the meeting for tomorrow morning, my request.
Why are you saying 8? There are 9, not 8.
9 provinces, sorry. If I not some of them can't make it for tomorrow, my request that we have a special meeting on Monday morning where all of these people must be present. Just a suggestion. Thank you.
And Chairperson, if I may, because a lot of this involves the provinces, can we have the NCOP there as well, please?
Look, your suggestion, Honorable Van Staden, is not going to be possible because we are involving quite a lot of leaders here. And I cannot confirm that we are going to get all those leaders, MECs, HODs, CFOs, all of them on the 24, like tomorrow or Monday. Let us plan that properly and have that meeting. Now, there's an addition from Honorable Wilson to get other additional people. Maybe write that into my group to see who else do we think we should invite. So the meeting, honorable members, can't take place within a day or 48 hours. It will probably be much later when we have planned properly and indicated who else, because we do not want to hear, no, 5 provinces are coming, 2 are not coming. So that meeting will still not be possible to complete the task. So let us plan for it properly and not rush to have it either today, tomorrow, or Monday. Thanks.
That's completely what I'm saying, Chairperson. Everybody must be present. So we can't have a meeting where someone is not present. So that's what I'm saying. If I can't make it for tomorrow, we must plan for Monday. But this meeting must happen in the next 7 days. That's all I'm saying. But I'll support you. Yes.
Okay. Honorable members, are there any other points to raise? AG, please, we'll work with you. I'll speak to Songezo. This is an extract from please redo your presentation. Don't take the extract as it is from a report document and paste it here. It doesn't help us. It's too small a font to read in the document and to read as a slide. And number 2, please make sure that if you want Capello to present 5 points, that she does that separately. Not halfway in the slide, she comes in, somebody else comes into the slide again. And then, and please, try and do just like Ms. Bilkic. What you present there, talk to it. Don't give us additional information which is not in the slide. If you want to say everything, put it down on the slide. We read it there. Otherwise, we'll have a difficulty to listen to you and read what you have put down there. Because those things always, we are augmenting what we have written there, but we don't know how to place it there. Because please write it down and put it there. Read the slides. Don't add more what you don't know how to handle it. Thank you very much. We will then address honorable members. Eugene, you want to say something?
Chair, that's on. Thank you, Chair. I think from my side, I just also see there's a hand from my executive, Mr. Andri Seketo. I don't know if he wants to also maybe say something, but we definitely do take your comments into consideration. Again, I do apologize for the presentation not being 100% clear. We'll definitely make sure we'll update the presentation accordingly. And then what we also do is, because we do know the importance of this message we're trying to communicate through to the members, we'll definitely make sure we do take all the comments into consideration. And I think we also already addressed some of the questions the members had in the next presentation that we'll be coming back with. But yeah, I do appreciate everybody's comments, and I sincerely apologize for the presentation not meeting the expectations. Thank you very much.
Okay, Andres, you've got your hand up.
Thank you, Chair. Good morning, Chair. Good morning, honorable members. I'm the business executive responsible for the unit that takes care of the health portfolio. So from our side, just 3 quick things, Chair. I'd like to reiterate what Eugene has just put on the table and apologize for the slide. I think it's also in the manner in which it was portrayed and not being portrayed as an actual presentation, but rather as a PDF document that made some of the fonts slightly smaller. We do take some of the comments that have been made by the committee, and we'll work on improving the slide and changing some of the colors so it's a little bit more legible. We certainly still hope that despite some of the challenges that were experienced with regard to the font, that the members still were able to obtain some value from the work that was done by the Office of the AG. We'd also like to just maybe put the minds of the members at ease to say that it wasn't all doom and gloom, Chair. Unfortunately, ours as the Office of the AG is to report based on the work that we've done. We don't give positive reporting, but certainly a lot of good work was done by the sector generally overall. You would also note the same sentiments were shared by the Auditor-General herself, Mr. Kani Maluleke, when she did the actual media briefing on the 9th of December. She actually commended government for having done quite well under trying circumstances, but obviously there would always be that room for improvement and things to be done better. And obviously, if we had applied ourselves a little bit better in certain areas, we would have probably achieved more. I think that's the underlying message here. insofar as it relates to the work that was done. We'll also maybe just from my side like to ask the committee members to also maybe read the actual special reports. The section that deals with the health portfolio, because we looked at 9 provinces, is quite large. So it makes up the biggest chunk of the actual special reports, which were issued in September and December by the Auditors General in the previous financial year. It was certainly challenging to compress all this information into small slides, and that's why you would have noted the colleagues when they were presenting, they have the summarized information, but they will try to give you more because there's more in the actual reports. So we'll just see how we marry and reconcile, trying to give you as much as possible information, but also within a limited time frame, and that will be a part of the challenge that we'll take forward in terms of repackaging our slides for the next session. But from our side, also thank you, Chair, for having made the time to engage with us and having given us the opportunity to also assist the committee in its oversight responsibility and its oversight role. We certainly do appreciate it, and we can certainly work on improving to make sure that we are of greater value going forward for the committee as well.
Okay, I see Honorable Dr. Jacobs has now changed his mind. He's seen his hand is up.
Thank you, Chairperson. Yes, I did change my mind because I wanted to earlier bring another response. I'm concerned about the manner which the portfolio committee members are putting what they are putting. It has been a very challenging time for all of the departments, and especially for our healthcare workers, our infrastructure, every single person who was involved in treatment and caring for our sick people. So the manner which it is put forward and portrayed as these being atrocities, I'm not very excited to hear that. Now I want to take us to slide 32 of the AG's report, where they actually speak about in their conclusions. They have 2 sections. There is a section in blue and a section in orange. Latter part of the section in blue, they say they know there was a slow response by the management to implement some of the recommendations and commitments made, but appreciation is given that management were occupied with responding to the pandemic. And I think we should really not lose focus of this. And then in the orange section, it is stated that the accounting officers have committed to implementing a number of the internal controls. Yes, it is a slow process. Yes, they do say there should be investigations and consequence management where applicable for transgressions. But I would think that when the AG comes to then give us the new presentation with the Minister, the MECs, and the other relevant officials, that they should also speak to that point in the orange section to tell us, maybe in a more clearer form, where the process has evolved to the time when they do come back. So a number of things would then have happened in terms of the request they would have made, and they would probably then have been worked on by the necessary departments to try to manage and address the questions which are raised by them. Thank you, Chair.
Yeah. Okay. You see now, I don't know whether it is an issue of a male thing. Men are very challenged on colors. Honorable Dr. Jacobs is calling this orange. I was referring this as brown. Somebody else is going to come and correct us and get the right color. So you see,
you're right, Chair.
Yeah. Look, AG, that is an important point to raise. When we come and look into the challenges, to raise the issues that were done properly, and because if they come and say because it was a rush, that's why we did this and that, but the issues of those things lying outside on the rain is not an issue of a rush, it's something else differently. Let's actually get you to put that on your report as what Honorable Dr. Jacobs has just emphasized. Honorable members, we then bring this meeting to a close. We will please write to me. I hear Dr. Honorable Wilson, and she's making a strong suggestion. We also maybe have the NCOP once and for all. I'll probably speak to the co-chair of that committee and see if we can have that jointly so that we can all be in one space and deal with it once and for all. Thank you very much, honorable members. We will still chat or see you late in the day, as there's got to be so much work that still needs to be done by yourself. We are coming back at 5 for another presentation, yes, of the NHLS. Thank you very much. AG, you are released, and members, you are also released. Have a good day.
Thank you very much, Chair and members. Appreciate it. Thank you.
Thank you, Chairperson.
Thank you, Chairperson.